My name is Alena and I'm a former patient of pulmonary arterial hypertension and a recipient of double lung transplant. And actually, my story starts with a family history. Back in 1980, when my mother passed away after I was born in Prague, Czech Republic, just 3 months later from my birth, uh, she just passed away, and the diagnosis was cardiomyopathy. And perhaps it was linked to pulmonary hypertension that was not well understood back then. Um, when I was pregnant with my daughter, actually, my daughter now she's 19 years old. And back in 2004, when I was pregnant with her, I started to feel symptoms uh, related to fatigue mostly, and many also syncopes, like continuous syncopes. They were over from time to time without any reason, and especially after some kind of exercises or perhaps normal movement in my house. Um, my husband, actually, he's a physician, and he told me that this should not be something normal, especially when he was seeing that my liver were turning blue at some point. And we were going to visit many cardiologists back then, but uh, most of them related these symptoms to pregnancy. Then I gave birth with my daughter, and I had another ectopic pregnancy. But after this one, my symptoms really got worse and worse until it was really so hard to tell that it's related to pregnancy. Luckily, I was diagnosed by a doctor there in Abu Dhabi, and immediately he just said that I have to look for the pulmonary pressure. Of course, at that time we did not know what does it mean, what does the pulmonary pressure mean, and when he did the echocardiogram, he just and he measured the pulmonary pressure. He said that I have pulmonary hypertension. Of course, it was really a very shocking time, and in the beginning, we did not honestly know what does that mean. We just thought it's something related to normal blood pressure, but until we went back home and we started googling, and we realized that it's a serious disease and that it's not like how we thought about. Of course, it was really a very bad time, and we did not digest the diagnosis. My daughter was still 4 years old, or actually 3 years old, and we did not know what to do next, especially when all of the websites and everyone was saying that the prognosis was really very low, and perhaps you might have 2 3 years maximum to live. Uh, then after that, my husband's and also it was the recommendation from our friends back then to search for a better center for pulmonary hypertension. Next topic. And that's why I reached out to decent hospitals. We contacted them, and there we met Professor Ziga and Professor Ghofrani, and he just looked at my case, and he realized that I was almost on functional class 4 with a very high pulmonary pressure, and also my BNP was really, really high. And I truly want to give my thankfulness to Professor Seeger and Professor Ghafrani and to all the team there in DC, because for me they were really like a family. And for traveling, of course, I had to travel every 3 months for regular checkups and for monitoring, the normal monitoring that they usually do, which is 6 minutes walk, echocardiograph, and of course, I had to do the right heart catheter just to detect and to confirm the diagnosis. This was in the beginning. They started me on sildenafil, first low doses, 3 times a day, 20 milligrams, I remember. And of course, they were measuring and doing 6 minutes walk and more tests also to detect the pressure and the resistance of the pulmonary artery. And it was not really going down at that time. And they also started me on Prosentan, but this was really the beginning. And they suggested to me at that time also if I would like to participate in this clinical trial, which has the inhaled treprostinil. And they told me that there is this trial which is randomized controlled trial, and that I might be put on placebo, or I might be put also on the real therapeutic medication. And the main aim of the inhaled treprostinil the trial was to see how the combo of the oral therapeutic medications such as sildenafil and or Prosentan they do along with the inhaled treprostinil. Of course, nothing to lose. I didn't think twice, and uh, even if it just included that I have to go every 3 weeks to travel to Gießen to do my tests. And of course, I just got motivated from my husband, and he told me that it can be a better option, especially that usually patients during a clinical trial they get more monitoring, and including the case that I was also in a very serious situation, and I was not really improving. So when they told me that if I would like to join, I definitely said I would like definitely to do it. Of course, I one of the things that was in my mind is that definitely I might be on the therapeutic medication. Well, this might not be the case in clinical trials usually, because in a randomized controlled trials, usually there is a big chance, 50%, that you will be on a placebo. But my belief that I will be on the real medication, which is the inhaled treprostinil, just made me believe that I am there and that I will be receiving the real treatment and that my condition will improve. And that, it gave me that kind of hope that I really wanted, especially during that time. Next, Robert. Please. Now, many questions usually arise in patients' minds concerning participating in clinical trials. Of course, for me, it was not an option to resist or to say no because I truly wanted. And as I said, the hope was my motivation. The hope of getting the real medication was my motivation to participate. Um, Also, I have to travel, of course, how often and how often did I have to travel? I have to travel every 3 weeks, and the trial duration was 12 weeks. And of course, each visit it was accompanied by thorough tests and thorough checkups, including 6 minutes walk, including also measuring the proBNP, including echo. And in the beginning of the trial, I had to do right heart catheter, and also I had to do it at the end of the clinical trial. And another question might be also is how long between signing and starting. In my case, it was very swift, and after signing the consent forms, of course, because the team they will provide you with all the information you need for you and everything you need to know about the drug and about also the side effects that might arise, and about how often you should use that medication. And in my case, I had to have that inhalation 4 times a day. And they gave me a special machine, like you saw here in my slides, that I had to clean every day and to do my inhalation 4 times a day. Um, and also, did I meet other participants? In my case, I did not. It was just this chance that I did not meet other participants, but the team was very, very friendly, and really they were really treating me like a family. And moreover, is that I was really feeling safe because I felt that I was closely monitored, and I guess this is very important for a patient to know that he will be closely monitored. So in any case or any time that any side effects might arise, you will be just in a way sure that you will not reach a point where something really risky or dangerous might happen because you will be under close monitoring. And this was the case when I was in recent. Next. Thank you, Robert. Of course, as I mentioned, I was really well taken care of, and the staff, they were always smiley and they were very cooperative, and I never felt overlooked. And also the tests that are just the normal tests that usually they do for any pulmonary hypertension patients, including proBNP. And like I mentioned, at one point I had to perform a right heart catheterization in a very comfortable atmosphere. How did I feel emotionally? Well, of course, they told me that I might face some side effects, including headache, sometimes pain in the jaw, also some kind of nasal bleeding. Maybe you also face congestion in the chest, many other also side effects. But even though knowing I might face these side effects or I might be probably on placebo, I was totally motivated and happy and really so optimistic to join the clinical trial. As I mentioned before, because I had nothing to lose. And I have really big trust in my physicians, and I have big trust in my team. And moreover, also I have big trust in my own belief that things will be better. Concerning the clinical trial, of course, you know that usually there are primary endpoints, and in this clinical trial, the primary endpoint was 12 weeks. And of course, throughout this period, the key measurements were taken to monitor any progress or to monitor also any side effects. Concerning the secondary endpoints were any worsening in the symptoms, and it was not in my case. Actually, I was feeling really better, and surprisingly, I felt also better. Of course, I was not able to exercise at that point because my pulmonary pressure was really high, exceeded 100, and my proBNP also was really, really high. But at some point, I felt better and I felt more capable of walking long distances. And as you can see here in the slide, my 6 minutes walk just increased from 380 to 400, and this was a rough number. And at the end of the trial, I discovered that I was on placebo. Honestly, I was really surprised, and I never thought that I was on placebo at that point because I was feeling the side effects, and I was feeling that jaw pain that usually the patients who undergo this clinical trial might feel. I had also some episodes of headache, and my 6 minutes walk also increased. Like I mentioned before, I was on the placebo effect. Now, despite that, I noticed improvement, and also this also will give you the real confirmation how much hope really plays a big role in cure. Well, in my case here, I think the placebo effect it's just showing at its own pace, and when I go back also to the days before, even joining the clinical trial, and when I was first diagnosed with pulmonary hypertension, I was reading this book for Professor Jerome Gluckman, and it talks about anatomy of hope. I can't deny that really this book had a big impact on my self-being and on me also feeling hopeful. And I think really hope plays a big role in cure. And in my case, also here, it just gave me the feeling that I was on the real medication, although it was not the case. I experienced the side effects that a real medication would make you feel. Uh, and I guess my experience here in the trial affected many of these principles written in this book. I truly recommend, Robert, the other slide, please. I truly recommend all patients or anyone who has or who faces any kind of chronic disease to read this book, because really it's a very fundamental one, and moreover it talks also, or Professor Brookman, he mentions real stories of real patients who were cancer patients, and whose the hope they had a big key in their journey, and also in their clinical trials, in which the placebo gave them the same effect as a real medication. And here also I summarize some of the key points of the book, which really uh, focuses on how much the hope gives you that effect, and it gives you also the motivation to participate in clinical trials, because at some point you feel that you not only help yourself, but you also help other patients, because in a way you participating in this, uh, you will you will give the hope to other patients when this medication will come out and will be a real treatment. Uh, yeah, and after that, of course, I was really I went into heart failure, and it was not immediately, but my case worsened because I was anyway diagnosed really very late, and I had to go and do double lung transplant, and I did it actually two times in Akaha, Vienna. The first time was in 2014, and the second time was in 2017. Well, in the first time, I had the boss, which is some kind of rejection that just happened, and that really needed uh, me to undergo the second one in 2017. And here I just want to take the chance to thank Professor Klepetko and all of his team back then, because really they were also like a second family to me, and I truly give my deeper gratitude to all of the team, including Professor Eigner and Dr. Yapsh and all of the nurses and all of the teams there. Um, the thing is that also after my second transplant, I faced another problem. Here you can see also the pictures of my new life. You can see my daughter now, my daughter and me. She's big enough. She was 17 years old in this picture. Whereas when I was first diagnosed, she was only 3 years old, and they told me that I have only 2 years to live. And honestly, at that time, I was just thinking, okay, 2 years, then she might be 5 years. And, I was counting in my head. It was really a hard time back then. But I can't deny that really the support of my family, of my husband, of my daughter, of his family, to the support of all of my teams, whether in DC, whether in Abu Dhabi, whether in Vienna, helped me. And definitely that gratitude that I had in myself for my body, because really it went through a lot, and it was such a hard journey for my body, but still it managed to stay strong, and it managed not to resist any kind of difficulty that it faced. And here, actually, the picture in the middle, it's also myself after my first double lung transplant. This was like 5 months later, and you can see the big difference. Before, with the pulmonary pressure, I was really suffering, and I had also like 20 kilograms of water. With heart failure, I was on oxygen. But here, I was able to breathe again. I had also my first attempt of skiing, which failed, honestly, as you can see with my daughter. with my husband, and here just cherishing all the goodness in this life, and happy with every breath that I'm taking right now. The story did not end here actually, but you can see also after my second transplant, I also had to manage or actually to overcome another kind of rejection. This time it's chronic rejection, which is unknown, and which was the nomenclature is CLAD, which is chronic lung allograft dysfunction, and it happened just like 1 year after my second transplant, and this was in 2018. I had a huge drop in my FEV, which is the main parameter in the lung function. And the doctors, they also, in Akaha, they started me on photopheresis. I was doing it every 2 weeks until now, which is also some kind of trial in a way, because usually dealing with photopheresis is not like something, it's not like the normal protocol right now, but it's still under investigation and under also trials. And honestly, when I go and do my sessions of photopheresis, I just feel so hopeful, and I feel safe, and I feel that my body is really responding in a good way. And the big example is that I truly have now very low lung function parameters, but I am really doing very well, and my body is still doing very well. And of course, again, it just goes back to feeling that gratitude inside, and that state of non-resistance, like non-resistance of anything bad that comes to you, and of course, are appreciating the body, and we can't also forget the support of everyone around me. Um, Now, when I was first diagnosed with pulmonary hypertension, I was told that I had only 2 years to live. My daughter was 3 years old, and now here I am with my daughter and my husband. My daughter graduated from school, and now she's in her first year of university. And I can't say that this is only for me, but definitely uh, this is all the work of everyone around me, the support of everyone around me, the medical team. And again, I can't deny how much hope plays a big role in this. And at the end of my story, I would like also uh, to tell everyone that hope really can never take you anyway uh, back. Um, I started these clinical trials. Actually, I did many, and but here I mentioned only one of them. And when I started these clinical trials, I had hope that I will receive the real treatment, that I will be on the real medication. While in both of them, honestly, I had only the placebo. But surprisingly, my body was really acting as if I was receiving the real one. And I can't deny that also my thinking that I am helping participating in this rather than only feeling safe, that I'm being safely monitored and closely monitored, but also I am helping other people with this. And definitely, this will reward you in a way and give you some kind of, it adds some value to your journey. So I do encourage other patients to participate in clinical trials because at the end it embodies hope, not only hope for you, but also hope for all of the patients, and perhaps might not only be something that passes like that, but it might also be the real cure to pulmonary hypertension or to other diseases. And thank you very much for listening to my story. And definitely, again, I would tell everyone to hold on hope, and always to believe in their body, and always to not to resist. I think this is really the advice that I would like to give myself and everyone, not to resist, but to believe whatever comes, it will be really the best for you. And also, don't underestimate your body. Thank you very much. And I would like at the end to thank uh, Alliance for Pulmonary Hypertension for hosting this webinar and for sharing my story. And of course, I would like to again to thank all of my team, whether in BC, whether in Akaha, or whether in Abu Dhabi. Also to thank my husband, to thank my family, to thank my family-in-law, everyone, my friends, all of my supporters, and to thank my body at most, because my body never failed me. And you have really to believe in your body. Thank you very much. Thank you.